I hear from so many of you as you go into perimenopause and menopause, how your body aches, how your bones are aching, how your joints are aching, your back, your arm, you have frozen shoulder, or just overall inflammation. And today we're going to talk about that because there's a new syndrome that was recently came out in July of 2024. And we are going to talk about that study in particular. And we're also going to talk about pelvic floor health. And I'm a massive fan of pelvic floor therapy as well. And we'll talk about why it's important to consider it. And today's guest, she's a pelvic floor therapist and has been one for over 25 years. And I'll introduce you to her in a moment. But just quickly, when I was going through perimenopause myself, and I'll share the story in detail, but I had what was called frozen shoulder. And at the time, I didn't know what caused my frozen shoulder. But over the last couple of years, we now know that it is tied to perimenopause and menopause. So if you're experiencing any pain in your body, joint pain, anything at all, inflammation, you're going to want to listen to today's podcast because we explain why, but we also provide solutions that could potentially help you. So before I introduce today's guest, I'm going to do a quick intro to who I am. My name is Andrea Donsky. I'm a nutritionist for 20 years. I'm a menopause educator and published menopause researcher. I'm also the co-founder of wearemorphus.com, a company that empowers you to take control of your health and symptoms with nutrition, lifestyle, supplements, and research. And talking about supplements, if you're looking to help support your body, your symptoms, and your overall health with supplements, I highly recommend checking out our line of Morphus supplements. They're high quality, they're third party tested, and they are what myself and my business partner Randy take ourselves. So they are trusted, and we have done a lot of research as to what is beneficial for us women in perimenopause and menopause. So I hope you will check them out on my website at WEARE Morphus MORPHUS.com, and you could check it out under shop. Today I'm speaking with Heather Marra. She has 25 years of experience as a pelvic physical therapist. She helps women around the world reduce fear and confusion about their bodies. Her specialty of pelvic health includes evaluating and treating women with pelvic floor dysfunction, urinary incontinence, sexual pain, and pelvic organ prolapse. These symptoms and concerns may arise in pregnancy, postpartum, perimenopause, and menopause. A highlight in Heather's career was working in China as a teaching assistant for maternal rehabilitation courses and presenting to the PT rehab team at the Chinese Olympic Center. She also authored the book, Connecting with Your Body Throughout Pregnancy. Heather has experienced the joy of 2 pregnancies as well as the adoption of 2 daughters with her husband of 20 years. Through her business, One Simple Step, Heather provides virtual pelvic health consultations and mobile pelvic physical therapy for women in the Lexington, Kentucky area. Now, here's Heather. Welcome to Menopause Reimagined, Heather.
Hey, Andrea, it's nice to see you.
It's nice to see you too. And I'm excited to talk about the musculoskeletal system. So let's start by you explaining exactly what it is.
Definitely. So the musculoskeletal syndrome of menopause, which is a new term that's coming out, but I think it's really helpful for us as women to understand what's going on with our bodies. The results can be bone loss, muscle weakness, frailty, and fracture. So all of those changes make us feel different and a lot of times have some pain.
And as we know, according to the research that we just had published, is that so many of us are experiencing it. So let's just go through some of the numbers that we talked about earlier. So if we look at joint pain, 58%, so almost 60% of women are experiencing joint pain, and it's in the top 10 most common symptoms. It's number 9.
Yes.
We look at body pain in general, 44% of women, shoulder pain, 35%, inflammation, 42%. Then you've got frozen shoulder. I mean, it's so common. And I think what would be great is for you to explain why it's happening now, in particular, as we go into perimenopause and menopause.
Definitely. So again, estrogen is our go-to. Estrogen is an anti-inflammatory. You go into the perimenopause, menopause. Again, don't think it just happens in menopause. It can be that 10 years, even a late 30s, 45 to 55. And that fluctuation, I've experienced it myself, going up and down can make different joints feel differently or discomfort. Let's look at some of these numbers that came out in 2024. 47 million women are going into menopause annually. 70% will experience musculoskeletal syndromes or symptoms. And of that, 25% will be disabled. That's not good. We have got to get on
Mhm.
top of this and help us understand what's going on with our body, have that conversation with our healthcare providers, and aggressively, what can I do to prevent or manage these symptoms so I feel better?
Yeah, no, it's real. And I've had women who have messaged me and have said, I can't get out of bed. My entire body is aching me. And what's interesting is that I guess for us, and like as we tie everything, really, I mean, everything can be tied back to hormones and all the different systems in our body. But as our estrogen levels are going down and our progesterone and things are shifting and changing, I like that you bring up the point that it's not just in menopause, that it could be in perimenopause too. So these are the times where we want to start looking at things that we can do to help prevent it or to help us manage it. And I know we're going to talk about some of those towards the end of the podcast, but I think it's important to note. So, for those of you who are listening, we're not just going to talk about it, we're actually going to provide you with some solutions to help you feel better.
Yes. And having these conversations with women earlier, like, do we have to wait till perimenopause and menopause? Should we start looking at these things in the 30s? Like our osteoporosis, what you do in your 30s impacts down the road. But often in my 30s, I'm not thinking about osteoporosis. I'm just having fun doing life, and life is
Yeah.
great. I don't need to think about that. But let's
Yeah.
reframe this conversation for women throughout the whole chapters of our lives. So this is an ongoing conversation.
It is, and and now we know the three main things that are an issue for us, especially as we go into menopause, is their brain health, heart health, and bone health, and osteoporosis being a big one of a big part of it, right? And that's why I've spoken to quite a few people on our podcast about exercise and strength training and making sure that our muscles are strong because we also know that muscles are having muscles and not weakening muscles like sarcopenia, all of that plays a role in longevity as well, and then quality of life.
Yeah.
So it's such an important conversation.
Yes. So another concern that women might be having is I'm having, say, this low back pain. I'm having this discomfort. I go and see an orthopedic doctor. They do an MRI, and 40% of these MRIs show no structural change.
Mm.
So then from which is good. You want to go see, is there something going on with my ACL? Is there something going on with my disc? Let's address those. But if those are negative and then the doctor says, "Okay, you look fine, but I don't feel fine." Then I
Mm.
know that, hey, this could be estrogen related. Do I need to have another conversation with maybe my primary care physician to say, "Hey, maybe we should add some estrogen in to help this inflammation"? But again, let's talk about the estrogen, but the diet, the lifestyle, the exercise. How can I look at this globally to feel better and stronger?
And I think you bring up a good point because for many of us, and I'm a big advocate of this, is that if you don't feel good, please go to your doctor and get things ruled out, right? I mean, that's just the number one thing, regardless of what your symptoms are. And a lot of the times women, especially if they'll go get blood tests and they'll say their doctor told them that they're not in perimenopause or menopause because their estrogen levels are in the regular or normal ranges, and or their thyroid test or whatever it is, right? So to me, this plays into a big part of the education and the understanding from the healthcare providers, because if they can't see it, they may not understand that there's something else going on. And the fact that you just said that they can, have these tests and they can come back quote unquote normal, is that they don't really know where to go from there, right? In all fairness. So I think this is why I wanted to have this conversation today, because I think this is where we women go to our healthcare providers informed and empowered and be like, well, even though it may not be showing up, here's what it could possibly be. I'm over the age of 35, or I'm in my 40s and 50s when I know it's very common to be, perimenopause is a common thing. So having that information with you when you go to your doctor or healthcare provider is so valuable.
Most definitely. And can I share a little bit of my story? Even right now, I'm
Please.
49 And so I just started the nano serum estrogen progesterone. But back it up, my conversation was my low back's hurting. I am a mobile provider of pelvic floor physical therapy. So I'm carrying in my treatment table of 35 pounds upstairs. I mean, it's not ideal. I'm still engaging my core, but I'm like, why am I feeling this? But my sleep was disrupted also. So then I had this conversation with my doctor, and she said, you are tapping on the door of menopause. So let's start you on the estrogen progesterone. Guess what? I sleep better. So my body repairs better. So I feel better. Then, as a physical therapist treating myself, I was like, okay, I've got to get a little bit more stronger. Let's do some wall Pilates. Should I do some stretching? I need to, so that's that mindset of I was treating myself and getting all those aspects together to feel better rather than dismissing, like, oh, my back hurts. That's just part of aging. That's just how it's going to be. My activity level goes down. I mean, I can tell you a story after women, like this has been a 10-year progression. So can we be more proactive to feel better, sleep better, be stronger, and reduce our risks of fracture, of bone loss, of muscle loss, frozen shoulder, those types of things. So I hope women feel empowered by this new term of musculoskeletal syndrome of menopause. Like, wow, this really is a thing, but I don't have to give up on it.
So you mentioned frozen shoulder, which I want to share my story in a minute. But when we looked at, so part of the research that we did through our signs and symptoms survey is we looked at the different body systems, and there's 11 of them. And we broke it down based on, this was nearly 5,000 responses. And we broke it down based on the different symptoms that women were experiencing the most. So the number one symptom, the number one system that's affected by the 103 plus systems is the nervous system. 31% of the women said that they were experiencing symptoms that were related to the nervous system. The endocrine system was number two at 24%. Number three was the digestive system at 11%. And the musculoskeletal system was 8.6%. So that came in at number four. So that's huge. That's a lot of women who are experiencing this.
Most definitely. And like the nervous system, if we don't understand or we're not informed or we're stressed, our central nervous system goes into more of a fight or flight. I'm not feeling good. I'm aging. I'm losing control. Like there's a lot of things that can build. So I think we definitely need to address all of these globally.
So when I just want to share my story about frozen shoulder for a minute, because the frozen shoulder research just came out. It was a couple of years ago that it came out. I think was it in 2023 maybe, that it was actually associated with perimenopause or menopause symptoms. And I remember when I was going through perimenopause, I had frozen shoulder, but I didn't know that it was related to perimenopause at the time. And I could not move. So for those of you who are watching us on YouTube, you could see the movement, but I'll explain it if you're listening to us on the podcast. So it was my left arm and I'm raising it and I couldn't put it back very far. Like I could literally maybe put it back like an inch if I actually was like trying. Whereas now I have full range of motion. And this lasted for well over a year. And I went to get acupuncture, I did massage, nothing helped me. And because I didn't really know what was causing it, I thought it was maybe, from how I was sleeping, a position, how I was sleeping. Maybe it was both. I don't know. But I ended up doing some research, and I ended up finding someone not too far from me who is a stretch therapist, and he specializes in muscle, and also he had a fitness studio, so he was very well attuned to the musculoskeletal system. And I went to several sessions with him and he completely helped me. Like it was life-changing for me because now I have full range of motion back, which was great. So I know that there are things that we can do so you're a pelvic floor therapist, for example, or going to somebody who specializes in stretch therapy or whatever it is that can help the body. I would love to talk a little bit about, you mentioned menopause hormone therapy as an option. What are some other things that we can do that can help this system to help us feel less pain, perhaps help our joints, help that frozen shoulder, help the inflammation in our body and all that body pain?
Definitely. I think awareness is number one. A lot of times, as we grow older, we may not be standing on one leg for our balance. You know, we may not move our arms all the way through the range, and this can be a gradual thing. So being aware of your body, really connecting to what is my body telling me? Don't dismiss these little symptoms, but be more proactive. Do I need to do a little bit more stretching? Wow, one arm is feeling a little bit tighter than the other. Where did this come from? I'm going to try some, well, I like a wall slide where you kind of slide your arm up all
Mm.
different directions. So you've got all planes. If you can't get that stretch and you're like, wow, it's tight, go and see a physical therapist to catch something early on. If the low back is feeling weak, is it from your core? Your core is your abs and your pelvic floor. I don't know how to engage my pelvic floor. Maybe I just need to go see a pelvic floor physical therapist for 1 or 2 visits to really engage my core. Maybe you've been doing Pilates, but you're just like, I get these cues from my instructor, but I just don't know how to tighten and engage. Um, Another thing to think about is your balance. Just check yourself. Stand on one leg while you're brushing your teeth. Whoa, I'm losing it. Well, can I work on it actively? Or I'm just not getting where I want to be. So maybe a visit or two, getting a well-rounded exercise program that includes some strengthening, some stretching, and some cardio, so that you're working on it. And our intensity as we go into menopause does not have to be 6 days a week. I think that's a different mentality too. Again, where's our energy level? But we do need to get some strength. Do we need higher weights, lower reps to compensate for that muscle loss so that we're offsetting that frailty and that risk for falls that would lead to a hip fracture, where 70% of hip fractures are occurring with women, and
Mm.
women have 30 to 30% of women have a fracture sometime in their life. So again, think your whole body. And again, just like you have 103 symptoms of menopause, your journey is going to be so unique. You got to be proactive about your needs specifically. And again, that's where, let me get a trainer, let me get a physical therapist, let me get somebody on board to help me, because I don't know quite how to maximize my exercise program.
And then obviously as a nutritionist, I'm going to bring in the nutrition part of it, because really focusing on whole foods, anti-inflammatory foods, those are going to help. And you could Google anti-inflammatory foods. You know, it's going to be what we talk about all the time: your fruits, your low glycemic fruits, your vegetables, your fatty fish, your omega-3s. Like, these are, important, because inflammation, as we talked about earlier, is very common and part of this syndrome. And whatever we can do to help reduce that inflammation is going to be very helpful. And also eliminating or really minimizing seed oils. And I've talked about my journey with seed oils. I've interviewed Dr. Kate Shanahan several times on this show. And for me personally, those seed oils are so pro-inflammatory. I mean, if I have, and it's also, there's a threshold. So if I have, quite a bit of it, like my feet are inflamed, I have pins and needles at the bottom of my feet. I could just feel that inflammation in my body. So listen to your body and try to experiment with different foods. How do they make you feel? Be in touch with your body, because all of that will make a difference. And also stress. When we're stressed, that'll also increase inflammation in our body. It'll affect our blood sugar. So all of these things, like lifestyle choices, all of them make a difference. And I know, one of the things, because I'm writing a book now, Heather, and I just finished the digestion chapter. It comes out in 2026, and it's
Wow.
going to be published by Simon and Schuster on menopause. And what's interesting to me, as I've written pretty much the majority of the book at this point, I'm now going through it and editing. There's this common theme that always prevails. And it's literally, watching what we're eating, being mindful of what we're eating, that whole foods diet, minimizing things that we know that create that inflammation, looking at our stress levels, sleep. I mean, it's always there. It really is the same, which is great, actually,
Yeah.
which I feel like there's this great theme that's throughout as we go into this phase of life, to really be mindful of all the different things that we're doing and how we're living, and really how they impact our overall health, our symptoms, how we feel, and also the musculoskeletal system, right?
Definitely. And like you said, it's the same message over, which should give us more confidence that this really makes a difference.
Yeah.
Speaking of the inflammatory foods, for me, it's sugar. I got off of sugar 10 years ago, and that's
Mm.
made a huge difference for me because it was giving me migraines. And so, again, to have an integrative medicine doctor say, no, get off of it 2 weeks before Christmas, I was like, oh my goodness,
Mm.
but I feel better. So it takes that intentionality to make the right choices nutritionally too. So I would 100% agree with you.
And I like that you brought up sugar because, one of the things I notice is you'll see a lot on social media. You'll see a lot of like the pros, the cons, the research behind this, and there's no research behind this. And at the end of the day, like I saw recently that sugar's fine and you could just, eat sugar. It doesn't matter. Like somebody was saying that there was like research or an influencer or somebody was talking about it. And the way I look at things is just like you said, how do you feel? Do
Mhm.
you feel better when you're minimizing or avoiding certain things? How do you feel? Let's say, for example, when you're consuming alcohol, or eating ultra processed sugar or whatever it is. So at the end of the day, listen to your body. And it doesn't really matter what anybody else says. All that matters is how you feel.
Mhm. Most definitely. And it's those lifestyle choices. They're hard in the moment. Do I want to feel good right now and eat that sugar pastry? Or do I want to feel better later on today and eat maybe some whole foods? Do I want to lay down on the couch and watch a movie, or is my body really asking me, go do some stretch, just go do a little bit of exercise, go out. I don't feel like doing it. Okay, go for a walk. Um, and making that conscious decision to feel better and feel
Mhm.
stronger and listen to your body. We're good at ignoring symptoms. Our body's talking to us.
Always, and it's a matter of whether we're listening or not, right? And sometimes it's hard to listen because, like you said, you're like, "Oh, I don't feel like doing that," or whatever, and I'm guilty of that too on certain things, right? So I feel like, yeah, it always comes down to choice.
Mhm.
So you're a pelvic floor specialist, and I would like to talk a little bit about how that plays a role with this whole syndrome.
Most definitely. So again, I see two labels: genitourinary syndrome of menopause, musculoskeletal syndrome of menopause. And this affects more, the GSM is more about vaginal health, dryness, atrophy, weakness of the pelvic floor, incontinence, pain with sex, those types of things. This is more of the MSK is more of the joint pain, the mobility, but yet they play in together. I've heard stories, oh, I started leaking, so I didn't go to the gym as a result. Then I have a weakness. Then I have a knee injury. I've gained weight, and all of a sudden, 10 years later, I'm leaking wearing pads, not exercising, feeling
Mhm.
awful. And now I want to go up this uphill journey. Will you help me? Yes, I will. But to see, hey, we could have changed this like 10 years earlier. So if you're having anything in the pelvic floor issue, whether it's leakage, constipation, you were talking about digestion, that
Yes,
plays
huge.
into it. Can we address these things? I'd rather fix a small problem because women, a lot of times, oh, I just leak when I cough, laugh, sneeze. I'm like, I'll
Mhm.
fix that. Let me help
Mhm.
you get
Mhm.
stronger so that we can be more proactive. I want you to be active. I want you to be strong so that you don't having that risk for falls, that weakness. I want to be a strong old woman, really. Like, let's
Mhm.
change this mentality. And so being proactive.
I like that because, I did a talk recently and I have this a couple of slides where I ask women, what do we think of when we think of women in menopause? And really the goal is to reframe our thinking and that, when we think of women in menopause, you don't want to think of old, you don't want to think of weak, you want to think of strong and empowered and confident and like all of those incredible things that we are, as we go into menopause. And I love talking about this because for me, I just love being in my 50s. I have to say, I love being in my 50s. I love being in menopause. It is a game changer. I mean, I can talk personally, and I know I've spoken to so many people who've been on our podcast that we just feel different. there's something that comes over us. So for those of you who are in perimenopause and you're in the, you're in the throes of all of those symptoms. And believe me, I was there. So that's why I could speak to this, because for many years, for 14 years, I was there, 11 of which I had no idea was perimenopause. So I thought I was just going crazy. So once I came to the other side and I was in menopause, I've been in menopause now for 4 years. It just keeps getting better from like a psychological point of view. I just feel like this sense of empowerment, this sense of I know who I am. It's just so different for us here. So on this side. So I love that, like what you're saying, and what I talk about is just that reframing how we envision, how we see women in
Mhm.
this stage of life.
Definitely. So then it's like, what can I do? Let me let me check off these lists of, oh, I'm doing great there. Oh, I need to work on that. Don't feel overwhelmed like, oh my goodness, it's all, but like you were saying, you get through perimenopause, you get to menopause, and you'll get through it. And having a game plan, and again, having somebody walk with you so that you
That's
know
so
how to do it.
important.
You cannot just Google it and, oh, this, I'm seeing this and this, I'm taking this because of this social media influencer. Like, no, what actually should you be doing? Because it's going to be different for you versus everybody else.
Yeah, and I love that. And who is your team? Who's your community? Who are the people that you trust and, and get information from? And like we said so many times is get your information from different people, not so many different people, because then you become overwhelmed. And then you're like, but wait, this contradicts, people that you trust. And then and then listen and do what feels right for you. And I think that that's important. And I'm a huge fan of pelvic floor therapy. And for me, I think I've gone for issues and then I've gone for tune-ups. And I like to go at least twice a year for a tune-up. For me, I feel like it's very important. And one of the things that I learned from my pelvic floor specialist that I absolutely love is how to relax, especially because you're saying I just finished that digestion chapter, is how do we relax the muscles in that area so that you could go to the bathroom. Let's say you are constipated, or you're not going to the bathroom like as you once did, as consistently as you once did, to really envision those muscles relaxing in that area. And I never really thought of it before. Like she kind of told me to think of it as a flower blossoming. And it's such a cool way to visualize it because first of all, it works. It's really powerful. And when I'm doing it, when I'm on the table, she's like, just visualize this. And I'm like, she's like, oh, there we go. It's relaxing. So talk a little bit about that because I find that super fascinating and not something that I ever really thought about until I started to visit a pelvic floor specialist.
Right. So I start with diaphragmatic breathing. And when you inhale and expand, that air should move the organs, the pelvic floor, into your underwear. Like breathe right now, inhale. And you should feel that pelvic floor blossom like you were talking about, just a little gentle and move back. And a lot of times women are not connected. Like again, there could be things that I've disassociated that part of my body. I had a C-section, I had trauma, I hate it, and we've got to go back to reconnecting. So we've got to get that mobility and that relaxation. So again, Kegels get a lot, or pelvic floor contractions get a lot of time, and it's almost, let's work on reverse Kegel or relaxation, because your pelvic floor is dynamic, and depending on what you need it to do, it should activate accordingly. And then if it doesn't, that's when we get the dysfunction. But again, things like, do you have a squatty potty or a poop stool to get your knees higher than your hips if we're talking about pooping? Because if we've got chronic constipation, we're bearing down, we're setting ourselves up for a prolapse. So again, coordinating that pelvic floor muscles. And again, I love going through all these little details about your pelvic floor, about how you pee, about how you poop, about how you have sex, all those things so you can optimize it. Because a lot of women just like, oh yeah, I'm fine. I'm like, let's dig in deeper. And so, yes, I love working with women so they understand going into stretches like a butterfly, like a squat. Can we relax those pelvic floor muscles so that you can poop and have a positive experience rather than a dreading it, like, oh my goodness, I'm going to have to go spend 20 minutes in the bathroom. It's painful. All those things affect then our mental status too. And, all of them play in together. So it's just all integrated.
So you mentioned the word prolapse. Can you talk about what that is?
So think about the vaginal walls become more lax. So the bladder, the rectum, or the uterus can drop vaginally. And sometimes it's scary because you may wipe and you feel a bulge vaginally, or you have a heaviness, or those are a couple of the things, or chronic constipation and something kind of falls out vaginally. And again, there can be different levels. And what happens is our ligaments, like holding everything up, are become more lax. It could be from childbirth, it could be from physical labor, it could be from constipation, it could be from hormone changes. Again, all of that contributes together.
Yeah.
Then we want to strengthen and coordinate, but I always want to do internal vaginal work because there could be muscle tension, scar tissue restriction that are contributing to that. And so we need to make sure that we can fully, again, go back to that blossom. If we can't move and come back, what's that restriction from? Let's move that and then get a good contraction and then manage intra-abdominally. Change how you're lifting that case of water. Are you pushing down? Are you lifting back up? Can we treat it conservatively? Can we get you stronger so that your symptoms are reduced and you feel confident and you have good, strong core? If you get to the point you're like, hey, I've done all that, I need something else, then we could do like a pessary that would be prescribed from your doctor that would give you some internal support or even surgery to repair. But I'm always going back to let's make sure that we strengthen and coordinate those pelvic floor muscles because you don't want to just go have surgery and not change your lifestyle and
Right.
go back to the same thing.
So would things like sitting on the toilet too long contribute to it, as well as, you're talking about lifting, which, for me, what's interesting is that we're told lift heavier in perimenopause and menopause, but can that actually be contributing to a prolapse?
Right. So how are you lifting? Are you inhale and then you exhale with effort? E with E is what I tell a lot of my women. And then you pull up. It's like zipping up a tight pair of jeans, starting with your pelvic floor. Again, starting with your pelvic floor and then going into your lower abdominals. But a lot of times we think rectus abdominis, just suck in my belly button. It's like, no, 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 no. It's got to come from here so that we're pulling everything up. So again, a knowledge of your body and what's going on. Then you're aware of, oh, that activity causes downward pressure. How do I modify it? That's when somebody else can help you modify that exercise, or you're in Pilates class. Do I need to go to that intensity and feel that? Is my back arching and I'm losing my stability? I don't need to continue doing that just to check off, oh, I did my Pilates class and I did strengthening, but are you helping yourself or hurting yourself? So just the awareness of the quality of the movement. Slow down your movements,
Mm,
engage it. It's again pulling everything up and doing it correctly. Because then I'm talking to my women, think about how your feet are on the floor. Think about where your pelvis is. What's happening to your abs? Are you pushing out? And then breathing. Are you holding your breath? All of it goes back together. And I feel like women then come back to me and like, oh my gosh, I'm so much more empowered. And I feel like I can do a better workout. And as well as I have the confidence to say to my trainer and my instructor, hey, can we modify that? Because that doesn't feel good. And again, giving women a voice to speak up is important.
I'm so happy you mentioned that because I feel like that's what I'm doing at the gym all the time. So I go to a gym where the person who owns it's in, his early 40s or mid 40s. And I'm usually the oldest person, if not one of the oldest women in the class. And I, doing, when we do warm up, like doing the jumping jacks and the up and the down and the jump, I'm like, I don't do that. First of all, I mean, I don't want to do that because it just doesn't feel good for me. But then my mind goes to, and you could, confirm or deny, is that when I'm jumping or, people who are runners, wouldn't that also contribute to some type of pulling down of the genitourinary system, like all those organs there?
Mhm. So again, it depends for each person. Are you more hypermobile? What's your history? Have you had 5 vaginal deliveries versus I've never been pregnant? So all those factors play in. And then also your personal desire. Like, I want that, hit workout and I'm going to do it. But how are you going to do it? Or saying each time I do it, I'm having leakage. Because
Mm,
again, if you're having pain, pressure, or leaking, those are things that the intensity of the exercise is too much. Maybe not forever, but right now. So again, being able to speak up and say, hey, I'm going to just tap my foot out. Or, hey, before I do a jump, I'm going to inhale, exhale, tighten, and jump. I
mm,
may do 5 reps and everybody else is doing 10 reps, but mine are more intentional to engage that pelvic floor and do it correctly. So again, looking at it differently to see what is the best activity for you. And remember, going back to this musculoskeletal syndrome of menopause, our repair of muscle injuries are longer. So you got to give yourself grace and space if you do have an injury, because it's going to take you longer to come back from an injury. So can we prevent injuries and also know that we need to just give ourselves more grace on our what we can and can't do. I'm not saying don't do it, it's how you do it and what's best for you.
mm-hmm. Yeah, no, for me, I've had 3 vaginal births and I'm just like and also, yeah, leakage is a big thing too, especially if I'm jumping up and down. So I always have to remember if I'm going to like a cardio class, because a lot of them are strength training, that I need to wear like some type of pad or something, right? Because then it's embarrassing because then I'm like, oh my gosh, I totally peed my pants. Like, so all these things you got to take into, you have to think about, right?
Mhm,
Especially for certain women, like you said, if you've had vaginal births or just in general, maybe like your body does that, right? So,
mhm,
which, common, right, for us. And I know it's an embarrassing thing to talk about. There was a story that somebody, I won't even say who it is, told me about where they're older and they went to a store and they had to go to the bathroom really badly. And they totally peed their pants. And she said that she was so embarrassed because she didn't have a pad or something on. And now they're looking at other options. Like, do they wear a diaper when they're in public if they can't get to a bathroom soon enough? Right. And these are conversations, although embarrassing, I think they're important to have because it normalizes it, but
mhm,
B, it gives us permission to be like, hey, listen, this can potentially happen to us, right? So if you're
mhm,
going on a long car ride and you don't know if you'll be able to find a bathroom, maybe you want to consider wearing some type of like I don't know. The word is, they call it an adult diaper. Like they need to come up with a better, I guess, word for it because it kind of, I guess even when I say the word, I'm like, we need a better word for it.
right.
Is there one? Like, is that how they market it? I don't even know how they market
Yeah,
it.
because again, it used to be that was just the sanitary pads that you're using, and now they've got more items that are made for leakage of urine, which is
Right.
nice that you
Yeah.
can have that. But also being aware of go see somebody so that we can address this and don't give up on it. Like
Yeah. Yeah.
that's just how it is. And then let's talk about another thing like vaginal estrogen cream. Again,
Mm.
maybe you need to be able to, you've done your exercises, you've seen a pelvic PT, but do you need some vaginal estrogen to actually plump up, rejuvenate those tissues on the pelvic floor? I had a woman, she's like, I cannot tell you what the difference is in the tissues after using some vaginal estrogen cream because that helps us. And the bladder is happier. And again, having more frequent UTIs, more leakage, those types of things all need to be addressed. So please don't dismiss this as this is just where I'm at. I'm just getting older. It's like, no, 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 no. We don't have to do that. We have so many options out there.
Oh yeah. To me, seeing a pelvic floor specialist is like just as important as going to your doctor. At least once a year. Like to me, it should be part and parcel because of
Mhm.
the fact we go to the doctor to get our checkups and our blood work and everything. We should be going to a pelvic floor specialist. And I wish that's why I love having these conversations because it's an important thing that I feel like it's gained so much more momentum and notoriety now over the last several years. But before that, like even my sister, after she gave birth to her son, she was 41 or 42, and I said to her, please go to a pelvic floor specialist. I wish I knew about it after I had my kids. I really did. I suffered, especially after my third, and I was 41 at the time. I wish that I had known about pelvic floor therapy at the time. I just
Yes.
didn't.
And
So we
that's
know
what
so
women
much
are
more now.
saying. Why didn't somebody tell me about this sooner? So
Yeah.
we've got to continue to get the conversations out there.
Yeah, no, and it's so helpful for so many things. And I've shared before too that I had a pain in my like on my left bum cheek, like kind of like where the bone is, the sits bone. And it's because I'm guessing maybe because I sat a lot or sit a lot or whatever it was. This was a few years ago. And I went for massage. I went for so many different things. Nothing helped me. And I went to my pelvic floor specialist and she was able to help me. And I was like, it was gone. I was like, wow, that's like
Yeah.
magic. And I
Yeah.
couldn't find anyone that could help me. So so ladies, if you thought about it, you haven't thought about it, please make an appointment. So, which I guess would lead me to the next question, Heather. How could people, because you're in Kentucky. So if you're in
Mhm.
Kentucky, what area of Kentucky are you in if someone wants to come see you in person?
Just outside the Lexington, Kentucky area. And so I have mobile services in the Lexington area. I bring my treatment table to you. Again, can we break down a
Amazing.
barrier? I don't want to go to a
Yes.
gym. I don't want everybody to see me. I'll come to you. And so that's what I do. But I also offer virtual visits. Again, if you just want to have that conversation and start, okay, what's going on? What's pelvic health? I've worked with women, they're like, I'm scared. I've had a referral for a year, so let's have these conversations. And so that's why I offer virtual visits, consultations, just about women's wellness and pelvic health. So I'd love
Mm.
to talk with you.
I like that a lot. And then can you also, and I guess, yeah, I guess you can help. So if there's somebody's not in Kentucky or near you and they want to go to somebody in person as well, can you help with referrals and or is there a website that people can go to find someone in their area? Of course, you could search it online, but
Right.
obviously you want to have somebody that's reputable and you could trust.
Definitely. So one website is pelvicrehab.org, and then you type in your area, and there's a couple of certifications for women's health physical therapist, WCM, WCS, and PRPC. And so again, you're looking for a little bit more certification. Um, that helps interview your pelvic floor PT, even calling up or look them up on social media. Can you connect
Mm,
with their personalities? And again, another thing you can do is pelvic rehab near me and just see what's around. And then having that conversation. Do you do internal, vaginal, and rectal work? Because some people have said, oh, yeah, I do pelvic PT, and you go to a gym and you're doing stretches and exercises but
mm,
nobody actually assessed internally, vaginally. So that's a big aspect of getting the complete pelvic floor evaluation and treatment. Because again, we want to look at any scar tissue, C-section, hysterectomy, um, vaginal deliveries, tears, I mean, again, if you've had any GI surgeries, anything rectally as well, we're working on all those issues so that we get great mobility, release the tension, address the pain, increase the strength, and optimize how you feel.
I love that. Is there anything, Heather, that we didn't talk about today that you want to talk or you want to mention before we end today's interview?
Um, I would say just like at the end of this study, there was some things to really support and prevent MSK, the musculoskeletal syndrome of menopause. Again, getting screened for osteoporosis at 65. How are we thinking about osteoporosis? Are you doing supplements? Vitamin D3, magnesium, vitamin K2 were some of the suggestions. What are you
Okay.
doing to make your bones and your muscles strong? Are you getting resistance training? Increasing protein intake, that's key, a basic thing. And then even creatine intake. So again, having this perspective of all these things of lifestyle, I can be stronger. I can feel better. I I need to have a conversation about getting some estrogen, seeing a pelvic floor physical therapist. So I hope this has encouraged women to go actively take control of their health and feel better. Like you said too, I want to feel great in my 50s. Let's rock
Yeah,
this.
I love that. And how can people get in touch with you?
Definitely at onesimplestep.today is my website. Spell out the word one, simple step dot today, and send me a message. I'm also on Instagram and Facebook. So again, reach out to me and then let's start the conversation. I would love to answer questions as well. Women asking questions, getting the answers, and getting the plan for you.
Perfect. And it's one simple step on Instagram.
One simple step today on
today.
Instagram. One
Awesome.
simple.
All right. I love it. Thank you, Heather.
Thank you.
I hope you enjoyed my interview with Heather and you learned a lot about the musculoskeletal system as well as your pelvic floor health, because I'm like I said, I'm a massive believer in pelvic floor therapy. Please go check out the websites that she recommended. Ask a friend. Maybe there's somebody that can recommend someone to you. I actually had a friend who recommended to me a pelvic floor therapist that I've been seeing, and I'm really happy with her. I think she's amazing. So if you enjoyed today's interview, please share it, because the more you share shows you care. And please take a moment to rate and review our podcast, and then also support our sponsors, because without them, we wouldn't be able to bring you these amazing interviews every single week. Thank you for watching. I know there's a lot you can be doing, but instead you chose to spend your time with me. And for that, I am grateful. I'll see you at the next interview.